I'm Alexia, and this is my video submission for Assignment 3 for HLST 320, Teaching and Learning for Health Professionals through Athabasca University. I'll be working with John, a 57-year-old male with prediabetes who needs to lose 10 kilograms to minimize his chances of getting diabetes. I'll be providing one learning objective in the cognitive domain and will measure his progress by his ability to recall as per Bloom's revised taxonomy under remembering. I'm Alexia. I'm one of the nurses here. I'm going to be taking care of you today. I see in your chart that you have talked to your doctor about losing 10 kilograms of weight, and what he says is that you're pre-diabetic, which is, right? So, are you ready to talk now? I want to be clear, my objective for you today is for you to learn about what you can do to decrease your caloric intake so you can be 1,500 to 1,700 calories in a day. Is that kind of reasonable? Perfect. So let's get started. Prediabetes is a term that describes blood glucose levels that are higher than normal, but not high enough to be diagnosed with diabetes. Prediabetes impairs fasting glucose, impairs glucose tolerance, also has an increased risk of cardiovascular disease. Diabetic foods, special foods are not necessary. Just eating kind of a balanced meal, lower in fat, high in fiber, lower in saturated fat, and low in calories. So we can look at food labels for that. You can kind of check what calories they are. This chart here, that picture is kind of what you want to do when you're eating a healthy, balanced meal. So on this sheet, it says 1/4 of your plate is meat and alternatives. Okay, 1/4 of your plate is grain products, and then half of your plate is vegetables. Your milk and your alternatives are kind of off to the side, and then so are your fruit. So you can see kind of the bulk of your meal is your vegetables. And what they recommend, and I think it's up at the top here, so if you can look at the top there, it says 1 leafy green a day and 1 orange vegetable a day. The orange vegetable is used to help your eyesight. So pretty cool. What you're doing is ultimately decreasing your calories in exchange for higher nutrients, which is what we want to be doing in this case. So I kind of spoke a little bit about what that looks like in that kind of picture. Can you repeat back to me what kind of the main priority of our objective is today? Awesome. Yes, it is to really decrease that caloric intake to 1,500, 1,700 calories a day. So perfect. You got that exactly on the mark. Awesome. So I think, for me, I think you really got this under control. Do you have any questions, or what did you like about what I said? Yeah, I really like the visual of the plate and just kind of what is all going to be in there. Yeah, and I really like that you want to kind of stick to that 1,500, 1,700 calorie mark. Perfect. Well, I'm so proud of you for talking about this with me. And if you have any more questions that pop up later on, we could absolutely talk about it. I'll leave those papers with you so that you have them. All right. I will see you later. Okay, bye.